Hi, everyone.
Good evening.
Good evening. Welcome. Tonight's webinar topic, we're going to talk about our new partner-assisted stretching program here at Michigan Center for Regenerative Medicine. Michigan Stretch Therapy is the name for our partner-assisted stretching program. Really excited to tell you guys about this process and this program that we have. We would have liked to introduce our physical therapist tonight live. Unfortunately, he had prior commitments, and so we videotaped an introduction that we'll play for you here in a little bit. But want to talk to you a little bit about partner-assisted stretching, why we've decided to incorporate that into our clinic.
Yeah. So here at Michigan Center for Regenerative Medicine, we're always trying to look for ways to improve outcomes, to improve patient outcomes overall, right? So in our search to do that, we try to optimize our techniques in doing our procedures, making sure we offer the best quality products of orthobiologics through Graylage technologies. We've incorporated other modalities and treatments like shockwave, electromagnetic transduction therapy, and then we incorporate our resources in the community like with physical therapy. And stretch therapy just kind of makes sense to kind of what we're trying to achieve.
Yeah, so we get our patients optimized and their best possible outcome with the regenerative injection techniques and the injections, just as Dr. Santana was alluding to. And then when we get that tissue rehabbed and regenerated and functioning properly again, a lot of times there's some abnormal movement patterns that have developed over time. Working with physical therapists and developing stretching and strengthening programs has been really helpful for our patients. But we've also noticed additional improvements when patients enroll in a partner-assisted stretching program. And there are added benefits to partner-assisted stretching that physical therapy doesn't always address or doesn't have the capabilities to address. The knowledge is slightly different. While a lot of our partner-assisted stretching techs have a physical therapy background, there is additional education and additional knowledge that comes with that.
Yeah. And the nice thing about the partner-assisted stretching too is that the more I learn about it, so it's not just for our patients or athletes, it applies to everyone. So essentially, with how we all work and function now, we're always either sitting and sedentary. So we always use that, sitting position, flex position. We look over our laptops and our tablets and our phones and always kind of crouch this way. So everything's being compressed and contracted. So with partner-assisted stretch, the idea is you're trying to open up all these segments again with the system of somebody who knows anatomy very well, so it's done safely and properly. So a lot of people can benefit from this, not just from your day-to-day aches and pains, but somebody who's trying to improve physically or even in an event or a sporting activity or something like that.
Golf is a big one. I enjoy the sport quite a lot and have noticed significant improvements in my flexibility, my swing, my tempo, and utilizing partner-assisted stretching. Tennis, basketball, you name it.
Yeah. Anyone.
Really anyone and everyone.
Runners,
Runners is a big
everyone, yeah.
So I guess with that, maybe at this point, I'm going to start the video here.
Only because the volume is a little low. To the window. Yeah, there.
Sorry, gang, a little technical.
There it is.
All right, we'll figure this out here.
Then go down there. Hit the space bar.
Hi, everyone. Thanks again for tuning in.
As Dr. Santana said, you might need to turn up your volume on this for the video.
MD from university, and I've been practicing in outpatient orthopedics for several years now. So looking forward to working with you.
Yeah, and we've experienced a lot of the benefit. Our patients, I should say, have experienced a lot of benefit from cross referrals back and forth. Our interest in working with Paul is really based on those incredible outcomes you're able to get, which includes working on people's flexibility. A lot of parts of what we need muscles to be able to do is be strong, have good endurance, but be flexible, be able to give our joints, our spine in proper range of motion, stability. As part of what we do in a regenerative medicine practice, the rehab arm of what we do is extremely important part. So, without further ado, rather kind of jump into the benefits that people have on partner assisted stretching. What we're planning to do with assisted stretching.
Absolutely, yes. Well, first of all, with partner assisted stretching compared to self stretching, the person's allowed to relax a lot more because obviously they're allowed to lay down. We're doing all the work. You can relax. We can take the joints into a larger range of motion and therefore deliver a better stretch. Also, there is the ability to maybe do more harm if you're stretching yourself because maybe you're not flowing up to date on the best techniques. So that's something that we teach our stretch techs to make sure that they have the safest techniques.
The important thing for patients to understand is that they're not just getting stretched, but they're being educated on the proper way to stretch, so that when the stretch therapy sessions end, they can continue those benefits on their own at home with intermittent visits and intermittent treatments.
Excellent, yes.
So we wanted to do I guess, relatively quick demonstration on what this looks like. I guess at this point, let's give it a go.
So one of the things that Michigan Stretch Therapy brings is really the technique, right? Because when we're stretching, we want to make sure that we're stretching contractile tissue, which is muscle and to some degree tendon. But when we're doing that, we also want to be protective of non-contractile tissue. So we want to make sure that nerve tissue, discs, ligaments are all preserved so that we're not creating a problem while trying to solve another problem. So that's one of the things that goes into our training with our staff. They have a long, extensive list of protocols and contraindications. So they are well aware that when a patient comes in or a client comes in, what to do and what not to do. So being safe is first and foremost. So I'd like to demonstrate that right now. So I'm going to have you lay on your back for me.
Good.
Okay. So the typical way that you will see people stretch the hamstring is they will take the leg in full knee extension, and then what they'll do is they'll raise a straight leg just like this. And then what they'll do then is they'll bring the foot down, and the person will experience a stretch in the back of the leg. Where do you feel that, Dr. Nabity?
Yeah, closer to my knee.
Closer to the back of the knee. That's a sciatic tension nerve position. The muscle belly of the hamstring is here. That's where you should be feeling the stretch. So we're going to take the hamstring, we're going to pick up the slack at the hip because it's a two-joint muscle. And then what we're going to do is we're going to slowly bring it into extension. You'll notice that the foot is not brought down towards the person. We are straightening the knee, but where do you feel it now?
More in the butt.
Exactly. So you should feel a stretch, and you can see the bulk of the hamstring as it's being stretched. So that's just one example of how we would stretch differently. Go ahead and bring that down. What we'd also do when, let's say, we're stretching the cervical spine, we want to make sure that we are protecting the nerves that come out. So I usually will have a patient with a little bit of traction. And and then we can get a safe stretch like this. So time you should feel a little bit of pull on your head and neck while I'm pushing down with my right hand, and you should feel a good, comfortable stretch up in the upper quadrant there. That feels great.
So, Dr. Paul, some of our patients will probably wonder, what's the difference between assisted stretching and physical therapy, and why would they do one over the other?
That's a great question, Dr. Santana. Well, with physical therapy, one, you are constrained to typically one body part. So if a person has a prescription for therapy, it usually is for their knee, for their neck, for their back. The therapist is constrained to treat that area. You also are treating under the limitations of the person's insurance. So they might only get X amount of visits, and then they're required to be done with therapy. So with stretch therapy, you can come as often as you need to. You can work on multiple body parts. You can use your HSA to fund it, and there's really no limitations. So when your physical therapy benefit is exhausted, we offer that next step, that bridge.
Sounds great, because it seems like it's a give and take interaction and a very dynamic type of interaction between therapist and patient. So it can evolve to treating different things in multiple areas rather than just sticking to what the insurance will allow and improve. And because our bodies is made up of different parts working together, you can't just focus on one part.
Absolutely. So when, again, we can work on different groups. We listen to what the goals are of our clients. Everyone who comes in here is a different one, right? Some people just want to feel better. Muscles are very obedient, and if you keep them in a short position, they'll stay in a short position. So a lot of people are sitting all day, so then they tend to get a little shorter in the hip flexors as well. When they stand, that's going to rotate the pelvis a little bit more forward, and that's going to create a little bit more stress on the lumbar spine. Some people want to perform better at their sport, golf, pickleball, maybe they're runners. If you can imagine, let's say we gain or we lose 3 inches of stride length. Now we gain that back. Every time you're taking a stride, you're gaining half a foot. So that can improve your time, that can improve your performance. We work on thoracic mobility so that when you're a golfer, you can get that bigger swing. But we can also work on your hip mobility too. So we can cover the gambit of what we need to do to get you to your goal.
I think this is very helpful. It's always nice to do a live demonstration to put action behind the words. So thanks for taking the time to come tonight. And if you're interested in Michigan Stretch Therapy, found at Michigan Center of Regenerative Medicine, want to take a look at you, evaluate something we can help out with, we'll be happy to treat you. Oh, thank you.
Thank you very much.
Yeah.
Thank you.
All right. So hope you all enjoyed that. Hope you all could hear that. IT is maybe not our specialty, but we are quite versed at helping people with their orthopedic complaints. So we do have time for questions. It looks like we have a couple questions come in. Let's see.
Okay, so
Yeah.
sorry about the audio. It was not my specialty, but yes, you can turn up your speakers, and yes, we'll try and work with our IT groups. We can maybe put some captions on there as well on the recast. So I think that was a nice explanation by Paul, right? So I think also kind of just looking back at his response, and the more I think about stretch therapy, is that the big difference with physical therapy, even though physical therapy is covered by insurance, is that with physical therapy, usually you have to have a diagnosis or something broken for them to fix and address it, which they do a really good job of doing that. The one big advantage of stretch therapy is that you don't have to wait to have an injury in order to avail of what they do. Actually, it will probably excel at preventing injury, because if you think about it, we get injured when we're fatigued or when the muscles are tight or when muscles are cold and you overdo things. With stretch therapy, if you have really compliant muscles and your joints are compliant, your risk for injuries are much, much lower. So I think just for overall maintenance and prevention, I think that's where stretch therapy makes a lot of sense.
Yeah. And you're starting to see it show up in the communities. We're not the only clinic to start to incorporate stretch therapy. I think you're seeing lots of other offices start to incorporate this, standalone clinics that are based strictly on stretch therapy because it works. It's quite effective in preventing injury and helping people be their best version of themselves in their preferred sport. And then for our patients recovering from their regenerative procedures to help prevent that whatever tendon issue they had, ligament, cartilage, you name it, whatever orthopedic problem they had that they came in for, and we were able to successfully treat, help maintain those gains and prevent re-injury and damage from recurring sooner than it would otherwise.
I guess we can take some questions from the chat room. First question is from Denise. When you come in for a stretch, you don't need a script, correct? That's correct. It's you come in, you make an appointment, and then you get to meet one of our techs, and they work with you one-on-one for 45 minutes, which is a really excellent time to learn more about the patients, what the goals are, and really get a really good treatment in there.
And we set it at 45 minutes because we didn't think 30 was quite long enough. Most stretch therapy clinics is limited to 30-minute stretches, and we wanted to give that extra time and that extra benefit for our patients. We thought it was a significant advantage.
Okay. Yep. Here's a comment by Marlene saying that the stretch that she saw is something that she could not do since she's an older person. So Marlene, so that example was tailored toward somebody like Dr. Nabity. When the techs work with you with the stretches, they would tailor to your goals and your abilities. They're going to work with you in a way where that makes sense for you. So they're not going to put you in the same type of stretches that somebody whose goals are to swing a golf club much faster than you normally would.
Yeah, we just seen some other comments about the benefits to this. Patients of ours who have either had stretch with us or done stretch elsewhere, situations where physical therapy hadn't worked for them and stretch therapy did. So we've seen that as well. It's a big reason why our interest in incorporating that into our center and again, really focusing on outcomes. That's really what our clinic is based on, is our patient outcomes, and we want to continue to add services that we see as being valuable to help our patients in whatever way they need.
Yeah. So if you guys are interested in Michigan Stretch Therapy, you can reach out here at the Michigan Center for Regenerative Medicine. The number is 248-216-1008.
And you can look us up online. We have a Michigan Stretch Therapy website, as well as our Michigan Center for Regenerative Medicine website. If we can answer any questions for you, please give us a call, and happy to treat you and your specific indication.
Yeah. Good night.
Good night. Thanks.
Thanks.